And proprioception will also involve the ability to monitor, in a way, your internal environment. So, without looking, I know I've got my fingers steepled in a very sort of sage and knowing sort of way. You don't need to look to check to see whether your arm is folded or your legs extended or flexed at the knee. You know these things automatically. That's proprioception. So joint position, within all joints there are sensory nerves which form part of the articular nervous pathways and the major nerve joints. There are sensory nerves which, if you like, monitor the position of the joint. Furthermore, you usually know if a muscle is relaxed and quiescent, or whether there's an increase in tone in your muscle, for example. So proprioception also involves monitoring the muscle tone so that you actually are aware of when you're using a muscle. All these proprioceptors, by and large, are basically, I was going to say primitive, but they're not. They're very sophisticated, natural strain gauges, stretch settings. So these little nerve endings on the cell are aware of that when they're being stretched. They can say, I'm being stretched. Therefore, I better tell the brain that I'm being stretched. And it's left to the brain then to work out very quickly why you're being stretched. And the conscious part of your brain, as well as the unconscious part of your brain, can say I'm being stretched because my elbow has been extended, or whatever. Or because my extensor digital longest muscles just contracted or relaxed. How do we test for proprioception? Have our patients, you're all booted, aren't you? You're all in winter boots already. That didn't take long. Anybody in a nice, easy pair of Uggs that they can slip off? Nobody's going to volunteer. Come on, let's sit there.
To take a sock off, doesn't it?
So how do we test the proprioception of the joint? First of all, we can test the person's appreciation of whether the joint is flexed or extended. So if I say to you, if I push that up, so that's, you can say up, that's down, and this is like the old grand old Duke of York, that is neither up nor down. Okay? And close your eyes, and all you have to say is up, down, neither.
Up. Up. Down. Neither.
Okay. And you could go through all sorts of way. You could do the same with the ankle joint if you wanted to too. Well, so that's a pretty easy, simple way of assessing proprioception in the foot anyway. And that's worth doing, I think, almost routinely. Although I'm almost fearful of saying that to you because the routine of clocking seems to take forever. And I don't like it. I find it very frustrating. Why don't an instrument start? We're doing all this because we're sitting having a half-an-hour interview with the patient. Lots of this information can be gleaned in conversation as you're going along. Don't need to make a special, separate job of asking them whether they've changed their medication. Change your medication. Yes. Don't need the clipboard. Okay, thank you. Don't go away. Vibration sense. The vibration senses, nerves of vibration sense certainly travel up the lateral column. and enter again the parietal lobe. Patients with diabetes in particular, some forms of anemia, vitamin B12 anemia, for example, patients with tabes dorsalis. We put another name to tabes dorsalis, tertiary syphilis, and other unpleasant diseases. You will find that your proprioception is shot to pieces, as does your vibration sensor. A normal choir master's tuning fork, just the thing for carol singing this time of year. Just pinch it and let it vibrate before you place it on the patient. And again, whilst they're still watching that, can you feel that? Can you feel that? Then get them to close their eyes and do it again. Start. The bone is the best, is most sensitive to vibration. So you're going for bony prominences. Start at the so first met. Fifth met. You can, if you like, go to base of the first met. To malleolus line. Okay. So that's something that's nice and easy to do. Not nearly as much fun, however, as having a proper gadget to do it with. I will show you now a biosphenometer. Just see if that lead will stretch over here. Just let the have the bottom go. That should do it. This is a piece of kit that basically is an electronic tuning fork. It produces a vibration at the tip there. You can probably hear that. I don't know if you can feel it. Okay. Well, we've got that turned right up. There is a meter on there, calibrated meter. The units of calibration are completely sort of invented. We talk about VPTs, vibration perception, I'll say vibration perception threshold. And very kindly, this particular piece of kit has a chart with you, which is age-related, so you can read off the reading and see what the age group should be. So, for example, let's try no, I'm not with the tri-pan, so I don't think we ought to play this game. That's I'm not going to get it. That is pushing my luck.
38.
So what we do is to put it on full whack, ask the patient if they can feel it.
Yeah.
Can you feel it? So they know what they're feeling for. Now turn it right down and go again.
No.
A bit like the audiologist, this. Turn it up so you can hear what you feel anything yet?
Oh my gosh. Slightly.
Slightly.
Yeah, I can feel it though.
Feel that. Okay, and then you can read that off, which is 5. So this should be about 10 or 11 years of age.
Oh.
Well, the first value we've got from there is plus or minus 8 for someone who's 18 to 21. So it gives you an idea of sort of what the vibration threshold should be for a given age, and it gives you a way of fairly accurately measuring them. So that's a nice piece of kit. The problem with this particular piece of kit, which is why I know I can just walk it and pinch it, is that this piece of kit is not to be used in the draw.
Oh, right.
Because of the health and safety issue. The health and safety issue with it is toxic because it comes into your main